We'd like to welcome you to the Healthcare Revolution podcast, where we empower you to take control of your health, restore your trust in the medical system, and achieve lasting wellness. I am your host, Brad Powell, Doctor of Physical Therapy and owner of an award-winning foundation physical therapy here in the Salt Lake Valley. Each episode, we dive into all things rehab prevention, overall health, bringing you expert insights from leaders across the healthcare fields. Please note, while we aim to provide with the best knowledge and advice, the opinions shared represent those of experts in the field and are not to be replaced with professional medical advice. So let's revolutionize healthcare and wellness together. Welcome to the Healthcare Revolution podcast. Today I have with me Howard Quackenbush, who is a physical therapist. He's an athletic trainer, one of the most skilled therapists that I know. He's been doing this for 25 years, from my understanding. Is that correct? More?
Well, if only that were true. We're now pushing over 30.
Oh, over 30.
I'm getting old.
30 years he's been in practice and just coming with a lot of experience, a lot of background. He's been a trainer in the Olympics as a physical therapist. He's owned his own practice. Now he's partners with Mountain Land Physical Therapy here in Utah. He's worked in rural areas, which is a really hard place to practice. And you have to have a lot of experience. You have to have a lot of background. You have to know a lot about a lot of things and have a lot of resources as well. And we're going to talk all about those things and how we create community-based care and working together as a team. He's also the chief delegate of APTA Utah, which is a strong advocate for improving healthcare. We're going to talk about his efforts there and what we're doing in healthcare to improve the medical system. So such an honor to have you here today, Howard.
Well, thanks for having me. It's going to be fun to be part of this. I've been a big fan of what you and your team have been doing and in promoting healthcare in general and physical therapy. Thanks to you and your team for all you're doing. This is awesome.
Well, thank you. Tell us about your practice. How did this practice started? It's in Delta, Utah. Is that the first one where it started?
Delta.
Tell us how that started.
So it was kind of by accident. I started out as I had graduated from WashU School of Medicine out in St. Louis. And by then, I'd already graduated from BYU as an athletic trainer and had my ATC. And I'm old enough that when you had the ATC and the PT degree, you were part of a very select small group nationwide, having those dual credentials. So coming out of school, I
define for us what an athletic trainer does and a physical therapist. What is the difference?
It's like a lot of things. There's crossover. An athletic trainer deals a lot with prevention and management of athletic injuries. They do a ton to try to help prepare athletes to be safe in competition. They help them to manage small injuries. And then most importantly, they're there to manage injuries and things that happen on the field and then be a liaison to get them to where they need to be. They do some rehabilitation, they do a lot of prevention, and they overlap in physical therapy on the rehabilitation side. But typically in athletic training, it's very orthopedic, based. Yeah. Physical therapy,
so essentially, it's a team.
It's very much
two
a team.
People working together. A lot of the model we see nowadays, especially in Utah County, Salt Lake County areas, is a lot of the injuries are just managed in high schools, where physical therapists aren't being used. Athletic trainers just manage them. Tell me how you feel about that.
I'm grateful that we have management at all, because too often kids either do nothing or they go to Dr. Google to help them that way. So I'm super grateful for the athletic trainers and all their efforts. But I do think the team-oriented philosophy is so much better because everybody has their skill set and almost all of us overlap somewhere. And we can't be fussing or fighting over the overlap. What we really need to do is take what we do strongly and coordinate care with the patient or the athlete being the center of the care, as opposed to our egos being in the middle of that care.
Yeah. What advice would you give parents that have athletes that are injured in school and helping them navigate injuries? What should they know?
Like with most healthcare providers, a family has our family doctor. They have our dentist. I would love for them to have our family physical therapist, our school athletic trainer, and utilize that care as a mom or a dad, saying, I've got a gal, I've got a guy that knows my family, knows my kid, and they have their best interest in mind. I'm going to get their opinion. and then trust that professional to give a good, honest opinion and have the courage to refer, as opposed to, oh, I fix everything. Most of us, especially in our rural healthcare, we'll get to this, is I have to be a generalist. If I'm a specialist, I'm very limited in the rural areas. So I've got a big referral network of people to send to, because I'm not good at a lot of things. I know about it, but there's people that are better than me.
Yeah, and that's what it's all about. I mean, that's what the revolution's all about, is bringing the team together, abolishing this silo care mindset. Silo care meaning I can fix it all.
Yeah, and it's only mine. Yeah.
And I'm the only one that can do this, and no one else is better than me, right? But ultimately, when we understand everyone's role, that athletic trainers, their role is to be the beginning and to be the liaison, not necessarily to do the rehab process. They can help out with that, but it's to build the bridge to the physical therapist. And the physical therapist's job is to build the bridge back to the athletic trainer and to give them those key components, like, hey, this is where we ended in physical therapy, can you still work on these things? Because athletic trainers, man, I mean, how many athletes are they overseeing sometimes in these high schools?
I'd still volunteer for Delta. After we finish here, I'm going back to Delta to cover our football game tonight. I was in Mount Pleasant last night covering JV and freshmen, just as a volunteer. I strictly volunteer for that because we don't have that service available through the school district. But I know that last night we had probably 80 kids, and then
that's just one sport, right? Don't most athletic trainers oversee all the sports in the high school?
Yes, and Mount Pleasant, North Sanpete High School, has an athletic trainer. Her name is Jamie Withers. She is fabulous. But she came to me at the beginning of the freshman football game, said, Howard, will you please cover the games, because I still have to go in and cover volleyball in here, and I have this other activity and I have dance. She had 3 other teams to go keep track of while there's a collision sport going on. Of course, I was happy to help her out. She's so wonderful, but it's that team effort.
Yeah.
We have to
and
do
I
that.
love that you work together with her on that. You're like, okay, I'll cover this, you cover that. Where do I need to be? What's the best place for me to be right now? And I want to assist with this. That's what it's all about.
It really is. And so as an athletic trainer and physical therapist coming out of school, I had those dual credentials so I could cover a broader area. So I was highly recruited in the sports medicine world. I had an opportunity to spend some time with a pro baseball team on their rehab side of things, and then I was recruited to go, again, this is how old I am, out to the Jacksonville Jaguars expansion football team. As a PTATC. But those things just didn't work out because of family situations. Some of those jobs are very difficult with a family, and that was my priority. That was a personal choice. And so I had landed in Delta waiting for the professional football thing to come along. And I was introduced to Delta because back in the day, you had to find a job in a pamphlet. It was the PT Bulletin that would come out. And Delta was close to Payson, where I grew up, about an hour away. I knew where Delta was. There was a need. And the interview was, can you fog a mirror? Yes, I can. You've got the job. They were so desperate.
Anyone that has a heartbeat.
They would take anybody. I walked into the clinic on the first day.
You're like, I'm the guy for the job.
Yeah. The clinic was 15 feet wide by 20 feet deep. And that was the entire clinic. There was 1 5-pound cuff weight, a highboy whirlpool tank, a mat table, and a plinth. And that was physical therapy. And I was coming out of the sports med world where equipment and toys, anything, you had everything to nothing.
Yeah.
And I thought, well, this will be a challenge, but I'm only going to be here a year or two because I'm going to the sports med world again.
Yeah. And
I had several offers and opportunities, and there was one fabulous opportunity here in Utah that was sports medicine, main clinic, partial, double the salary which I was making when I was first starting out. And I was driving home thinking, I took this job, getting happy, and got halfway home, started having a feeling. I thought, oh no. Then I got down to Nephi, started having a strong feeling. I was like, oh no. Then I got to Delta. I called them and said, guys, I can't take this job. They said, how come? I says, I don't know. It's a feeling. And
It's not feeling right.
it is not feeling right. And again, it was perfect. But so we kind of just dug in. And it was a year later, and this was a time of HMOs, PPOs, where if you want to get in private practice, it's impossible. But then about a year later, Intermountain restructured, and they were getting rid of rehab services, who had actually hired me to be at the hospital down there. And as they restructured that, I had the chance to buy the clinics. And so I bought
So it was
Delta
from Intermountain.
From Intermountain.
You ended up buying the practices from Intermountain Healthcare. And
Yeah.
if you're not from Utah, Intermountain Healthcare is the biggest medical system here in this area. So
Yeah.
that's amazing that they just sold them to you.
Yeah, unheard of. So they did that for Delta, and then 5 years later, they called me up and said, "Well, we want you to do the same thing for Fillmore." And
So you
I
bought
said,
their Fillmore clinic as well.
yeah, but for the same deal as Delta, and which Delta was a steal. Now, I'm embarrassed to tell people what I got it for, because I was so lucky, blessed, whatever you want to call it.
Yeah.
It just worked out.
That's so
But
awesome.
then, now I'm a physical therapist with a secretary, and that was physical therapy in the county, and we've kind of we started growing it from there, and eventually we've had 6 therapists, 6 PTAs, administrative staff. We had 2 outpatient clinics, 2 hospital contracts, a care center contract.
You were doing a wide range of physical therapy.
Everything.
as
If
a
it was
medical
physical
team.
therapy in Millard County, we did it.
I love it.
Yeah.
What a cool...
and some athletic training.
And then you ended
volunteering on
up
the
doing
side.
it for about 30 years. And then just recently partnered with Mountain Land, and now going on to bigger and better roles.
Different roles, yeah, different roles. It's one thing to have full control and ownership, to being in a bigger group with fabulous partners that are very, very good at what they're doing. But what it did for me, and the reason I decided to do it, it was better for my community. After being in a community for 30 years, you know everybody, especially in it's rural, and there were things that
Everyone knows Howard and Delta.
They do, but the nice thing is, too, now it gave us access to specialty physical therapy care. Again, things I couldn't do, but now we have access to pelvic health. We have EMG.
So really, for you,
ultrasound.
it became a community thing.
100% community thing, because I was doing fine. I'm still doing fine, financially, emotionally, family-wise, but I wanted something better for my employees. But I really wanted something better for my community.
Yeah.
And it was just the right opportunity at the right
I
time.
don't know if I told you this, but I actually broke my first bone in Delta, Utah, at Bunker Hill.
And my wife is a bunker, so she's
I actually saw her name. I was going to ask you.
Yep, her
Bunker
cousin.
Hill was where I grew up. I mean, we went there almost every weekend, and that's where I broke my arm. And that's what started the cascade of injuries throughout the years. So,
Yeah. So
tell your
you're-
wife.
You're
that's
the one on Saturday morning going, wee, 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 on those 2 strokes.
We were ripping that track. Yep, it was on that the big step up before the finish line.
Got it.
And I came off that. I sent it. I was on a 65 KTM. I think I was maybe 12 years old, and I just sent it. I was racing my dad, and there was a little lip that I missed, and I endoed and just went right over the bar, stuck my arms out, and just snapped my arm in half. And I've never seen my dad drive so fast to the emergency room, because my arm was just at an angle, right? It was complete broken through.
Was it an older physician or a younger physician that saw you?
I can't even remember. I just remember I was way out of it. I mean, I was 12 years old.
Yeah.
But we were driving probably 95 miles an hour on that road as you come out of the track. And we got pulled over by a police officer, and he ended up escorting us to the emergency room. But yeah, I remember that. That's my claim to Delta, Utah. That's awesome that your wife is a bunker.
Anything to get you in town. We'll get you there.
I love it. Okay, well, let's talk about the complexities with the rural system. Okay. And as we talk about this, I really want to emphasize what you know and how it can improve the system as a whole. Because there's things that we're doing in our rural areas that are really powerful. Like, there's barriers that you guys have that we don't in the cities. But there's so many things that we can learn from what you're doing to improve our medical system and our ability to work together as a team. So tell me, what are the complexities, kind of your top complexities that you deal with in these rural areas?
Probably to preface that, I need to tell you what I teach my boys is the secret to life. I teach them that everything in life is about relationships. Okay, it's your relationship with God, your relationship with your spouse, your relationship with your family, with your friends, with everybody, and you'll never have influence on anyone until you have a relationship with them. So I teach them that's terribly important. The biggest challenge to rural is it's isolated. And so the number one thing you have to have is a really great working relationship with the people you have. We're blessed in Millard County with fabulous physicians. There is a...
And has it always been that way? I mean, you've been doing it 30 years. You've always had really good.
Because of loan repayment, there is a wonderful medical residency program called Cowboy Residency at Weber State University up there. Cowboy Residency teaches a family practice physician to practice medicine out in the western wilderness. They deliver babies. They take out tonsils. They take out appendixes. They do a little bit of everything. And for loan repayment...
And that's what you mean by generalist, right? Versus specialist. Generalists know a ton about everything.
Yeah.
Specialists know really deep about one thing. It's like, I'm a specialist in the shoulder. I know everything about the shoulder. But a generalist is like, no, I know every single body region, and I know who to call when I'm not the right person, right?
And for loan repayment for them, if they went to an underserved area, they could get loan repayment. So we ended up with 4 family practice physicians that had gone through Cowboy Residency. So I had 4 wonderful...
So they were trained to be really good generalists.
Yeah.
And to go out in these underserved areas and do it really well.
Do everything really well. And so they're only... Well, the first one was there before I got there. The second one came a year after I got there. The third one came 2 years after I got there. And the fourth one came about 10 years after I got there. And so we all grew up together. We were all in our late 20s, early 30s, and we got to go. So we had wonderful interpersonal but working relationship and a lot of trust. And so by having limited resources, you have to utilize good people. We have wonderful nurses. We have... visiting physicians, visiting, orthopedists, visiting internal surgeons. And so you have to start developing a relationship with all these people, because when you need them, they may or not be there in the hospital. They may or not be there in their clinic. They may be somewhere else. You got to be able to pull that influence card and say, I need some help right now, and have them pick up the phone.
And I love what you told me earlier before we started the podcast is like, you don't have every provider that's willing to share cell phone numbers, right? But when you have such a good relationship with these people, we know when to call people and we know when not to, right? We're not going to abuse that. It's been abused in many circumstances, but ultimately, if you have a really good relationship with a physician or an athletic trainer or another physical therapist, you guys all have each other on speed dial. And we're not going to call each other all the time, but when I call you, I need you. And when you call me, you need me, right? And that's what it's about, is working together.
I have a fun story about that. One of our good physicians, Dr. Bailey, down there, he happened to be the on-call physician, and we were at an away football game. And one of the kids got dinged up and concussion symptoms, and then as we were leaving, the concussion symptoms were worsening, which in the athletic training world, the physical therapy, sports med world, that's a bad sign.
Yeah.
Well, we're about 11:30 at night driving home. The parents call me. We're on the side of the road in the middle of nowhere assessing this kid, in the back seat of the parents' car. And I said, okay, we're going right to the hospital. So I called the hospital to say, we're on our way. And the nurses, it's a rural hospital. They shut things down, and they said, well, okay, we'll see, whatever. And I said, well, pass it on, doctor, we're coming anyway. Well, about 4 minutes later, Dr. Bailey called me. And he said, as soon as I heard that Howard had called, I knew it must be serious. Because why else would I call if they're doing this? And fortunately, the kid turned out to be okay. Everything worked out. But because you have that trust and that relationship, they know we're not going to abuse it. But at the same time, they know when you call, they also know that you're very qualified. And if you're calling, it's something's up.
Yeah, absolutely. I had on Sunday, I deal with a complex patient population, people with POTS and EDS, Ehlers-Danlos syndrome, which is like the ligaments in your body are really lax, right? But this complex population of people don't get served very well in emergency rooms. And this particular patient ended up shooting me a message on Sunday, and I think I just left church for the day. And I got this message from her that said that she had stroke-like symptoms. Actually, she didn't say she had stroke-like symptoms. She just said, my face is really droopy on the one side, my arm is numb, I'm slurred speech, right? And all these symptoms are coming into my head. And she's had symptoms like this in the past. And I ended up just calling her. And I called her. She was in the middle of a panic attack and just really scared that she was having a stroke and really fearful. She was on blood thinners. She was on all kinds of, different medication for different things. And I just worked on calming her down, and her friend was so great, and I walked her through what to do, and I said, let's go to the emergency room, let's get this taken care of. There are some serious things that are going on right now, but I want you to remain calm, like just how to breathe, because I knew this patient and she knew me, and it was just a beautiful relationship because she knew who to call, and I am qualified to help her. But I ended up saying, okay, I'm going to put you on hold, I'm going to call the charge nurse, so that way they're up to speed on what's going on. So I called the charge nurse, explained the symptoms, explained she's a medically complex patient, and they were prepped for this gal to come in and be able to, assess her and move her forward. I ended up calling her physician and letting him know of the situation. He ended up getting on the phone as well with the charge nurse and the attending physician, and she got great care. I think she was a little dismissed, unfortunately, for a little bit, but ultimately it was about the team working together and providing the best care for the patient, because sometimes these medically complex patients, whether it is complex or not, are not served well because they're a little different, But I loved your story about when you call a physician, they know it's serious, and that's what it's about. We manage cases the best way we can, 85, 90% on our own. And then there's 10 to 15% we need help with, and we need help fairly immediately. And if we don't have a good team of relationships, we don't know, how to make that connection. And that's why it's so important for providers to know each other, to know when it's not in our wheelhouse.
And it's that overlap. We all overlap in things. So, I could be good at that, but my physician's going to be better at that. He has better toys. He's got a CT scan. He's got these great toys for diagnostics when you need it. My athletic trainers, are on the field. They see the kids in the moment. Physical therapists are great diagnosticians. We know how to serve, manage, and improve stuff. And if we work as a team, it always turns out better. But it seems we keep using the same term, relationships. And it really comes down to building and guarding good relationships, because as we do, we have influence. We can make the call and get it answered. We can, have the patient trust that they can call us because we have that relationship. They know we care. And even if we don't have the answer for them, we know where to find it. And we'll help advocate for the patient that way.
Yeah, I love this idea of relationships that you are bringing up. It's so critical. What advice would you have to both, let's start with a young clinician first, a PT or a medical doctor or surgeon that wants to start to build this network of providers. What advice would you have for them? And then also, what advice would you have for the parents that are like, man, I want to build that network of trusted providers that have my back and my kids' back?
The only person, let me back that up a little bit. Some of my history. I grew up in a rural community. Payson was rural at the time, but my dad was a professor at BYU in the Spanish department. My mom has 3 master's degrees, and so we were very education heavy. But one of my mom's master's degrees was in counseling. And she would always, as a teenager, I'd have a rough day and I'd be trying to blame it on somebody else. Says, Howard, the only person you can control is you. The only person controlling your feelings is you. No one can make you feel anything. No one can make you do anything. You can control yourself. So for a young clinician, I'd say you're 100% in control of you, your environment, your attitude, and your relationships. And you need to own that. Too often, we feel like we're becoming victims. The fee schedule's too low, I'm not getting paid enough, or my schedule's too busy, or the paperwork's too heavy. Those are always all concerns. But it really comes down to, I have to own my feelings, my emotions, and I've got to go and do. And so the first step is look around you and see who's closest in your relationship ring. Okay. Is there a local family physician that also feels the same way, feels like they're overburdened? And as a primary care physical therapist, I now can take so much of that burden off of them. And if they trust me to do that, I can trust them to take the patients that I need to get to them.
Such a mutual relationship.
It's a mutual relationship, and you have to own that. So you look there, you look at the nurse practitioners, the PAs, look who's in your closest circle. And then when you have the opportunity to interact at community events, medical events, conferences, get to know people. Don't wait for them to come to you, because they won't. Okay, you're gonna have to go to them.
I love that extreme ownership. Like I'm taking the responsibility at building that relationship. I'm not waiting for anyone to come to me. I'm actually going to reach out to them and build that network myself.
Mm-hmm. We're all social people, and everybody loves to have somebody come to them and say, "You're fabulous. You're great. I want to get to know you," and they'll do it. People really are great.
I've always loved that about you. I think the first time I met you, you like literally walked up to me and say, "Hey, I haven't met you. I'm Howard." Right? And I was new to the group, and I'm just like, I don't know anyone. So that was really helpful to me to have a just outgoing person, and not even outgoing person. We don't have to be outgoing, although a lot of us are. Like just take that step to say, I'm gonna go meet these people. I'm gonna build this network, and I'm gonna remember things about people. I love that. That's great advice.
The very best advice I ever got that applies to a young clinician. I was actually a student getting my hours. So to get into physical therapy school, as you well know, you have to do volunteer hours so that you can put it on your application that, you understand what the profession is to get in there. So I was doing some volunteer hours with Brian Lambert in Springville. Brian is since retired, but such a great mentor. I love him to death. But one day, and again, at that point, I was an athletic trainer, so they were letting me function in the clinic pretty independently where it was appropriate. I see him and his physical therapist assistant kind of in the corner, kind of snickering and giggling a little bit. And I walk over, "Hey, guys, what's so funny?" He said, "Well, so-and-so over there, in the neighboring town." I said, "No, I really don't." I said, "Oh, he's a terrible clinician. He does stuff that's just so off the wall. But he is such a nice guy. People get better for him anyway." Then here's the thing he says, "You know what? If you were a good clinician and really nice, guess how far you'd go?" And as a student, I was just like, the sky opened up. It's like, okay, I can get that people are going to, but the body's trying to heal itself. The body's always trying to do things. But if I was really good and I was really nice,
next level.
Yeah, next level. So I've tried to implement that in my thing, because most
just be good at what you do. Be good at what you do and connect with the people that you serve.
Most people just want to know you care.
Yeah.
And if you show them that you care and you're genuine, you're genuinely trying to help, they'll cut you a lot of slack, and they'll be more open. Most of the time we need information. How are you feeling? Where does it hurt? What are you doing when this problem occurs? Or what are your symptoms during the day, at night, whatever. If they don't trust you, again, relationships, if they don't trust you, they're not going to share. And if they don't share, you're guessing.
Yeah. You can't do your job well. And ultimately, if we do a good job, it will be known. And we truly care about people, and we do a good job. That is half the battle. Just right now, maybe even more, because then you build this network of people that are raving fans of you and your practice, and then they just go out and tell all of their networks as well. So it's a pretty cool thing you can do when you just treat people well and you care about them. It's amazing. So any other let's actually talk about advice you give to parents. What advice would you give to parents on building their own network of great providers? Obviously, in these underserved areas, they don't have a lot of options, but at the same time, they still have options. What advice would you give parents?
Well, I'll start though with a story. I've been there a long time. Okay, and so I'm
30 years. I'm 35.
I'm now treating the kids of the high schoolers I first started with.
I'm 35 years old, right?
You little punk. So I happened to be down at the high school one day, walking through the gym, and the volleyball coach waved me over and said, "Hey, I've got this young lady here that's been having shoulder pain when she's hitting. She was an outside hitter, a really good little athlete." So we took a look at her, and it was just some shoulder instability. It's called impinging, but basically her posture was a little bit forward, and so her shoulder...
The ball was just kind of shifted forward in the socket.
So she was rubbing on that rotator cuff when she was hitting. So I showed her a couple of things, didn't think anything of it. About a week and a half later, I had her mom come up to me in the hardware store and said, "Howard, I need to apologize to you." I said, "You never have to apologize to me, but what are we talking about?" She says, "Well, you saw my daughter, a week and a half ago." I said, "Oh yeah, pleasant lady, young lady. You're so blessed to have her." "No, you don't understand. She's had that shoulder pain." I said, "Yeah, seemed to me pretty easy. Here's what she says." "No, you don't understand. She's had that pain for 2 years. You showed her 2 things to do on the side of the court, and she's better." I said, "Oh, that's wonderful. I'm happy." He says, "No, you don't understand. I forgot you did that. And she was one of my athletes back in the day." And I had to think to myself, whose fault is that? Was that her fault that she forgot I did that? Or was that my fault that I'm not reminding people what we do?
Oh, I love that story.
So as an advice to a parent, I would say, when you've had a positive experience with a provider, file it away and try to remember that I trust them, that they've been helpful, and then trust them to give you good advice in the future. And then the other thing is, I would say, when you've come in contact with providers, a good physician, a good nurse practitioner, a good PA, a good physical therapist, good athletic trainer, get to know them, get to know them as a person, so that when the questions come up, you can ask. And it's how we talked about a physical therapist trying to let people know what they do. I would tell a young parent, be an advocate for your kiddo, but also choose good sources of information. People that have done well for you in the past will continue to do well for you in the future. Over my 30 years, everybody likes the new flavor of the month. Whatever the new toy is, or whatever the new Instagram idea is, people jump on it and they want that. I had a youngster, a little football player last week, freshman, the kid's going to be a star, but had an ankle sprain. Went to... It was an acute sprain, just barely gimping around. And his parents started doing the Instagram search thing and went and had some modalities. And a modality is basically kind of a treatment using a toy, essentially.
Electrical stimulation, ultrasound, things like that.
And this modality, or this toy they want to use, causes inflammation so the body can continue to heal. The problem is that's for old injuries, not for new injuries. And they were being frustrated because their kid was not getting better, but what they were being given was something that would continue to irritate the problem. Mm-hmm. And so finally we were able to sit down and have an open discussion and explain the whys. And they go, "Oh, that makes sense." And the kid's well on the way to recovery now because he's young. He's going to heal up anyway. We just have to allow it. But they were searching for the newest quick fix, the new flavor of the month ice cream, when really they should have gone to trusted professionals, their trusted physician, their trusted physical therapist, their trusted athletic trainer, and be willing to listen to boring stuff, because boring has been around forever because it works. Mm-hmm. And
a lot of these modalities that you're talking about are coming up, and it's kind of like the cool new trend. Mm-hmm. but the trends go away.
Yeah.
But what stays tried and true is the foundational principles. And that's what you're talking about, is this 30 years of experience of seeing injuries. I've seen what's tried and true, and I've seen the trends. And this is you could say the boring stuff that's really going to get you the answers. But I love what you're saying, like, find a provider that you trust and then stick with that provider. And there are providers that move around, but ultimately you start to create this network of people that you truly, like, you trust them. And even if they leave, they can help you find someone else, right? And I love families that like link together. Like I have a bunch of different families that kind of see me as their primary care physical therapist. And they tell everyone in their family to come see me. Literally, I see their aunt, their uncle, their brother, their sister, their distant cousin. Like literally everyone's coming to me from this family. So I love families that share providers within their unit. It's like, this is our family practitioner. This is our family PT. And they share it with each other because those family networks are really important to them. And they only want the very best providers in their families.
And it's about relationships. You've developed relationships of trust. And I know that you've never made a mistake in your life. I make them all the time. But when I have that relationship of trust, there's a lot of leeway that if we're doing something and it hasn't been the most effective, they'll trust me to understand that, okay, I've been trying to do this, it's not working, let's find the next answer. Mm-hmm. And those relationships are so important, but you have to, as a clinician, you have to build them, but as an advocate for your family, if you're the healthcare decider in your family, you need to advocate or develop relationships so that you can have your people be taken care of because you have a gal, you have a guy that has your best interest at heart.
And I love this aspect of you trust them. Mm-hmm. It doesn't mean you're in the right office, right?
Right.
Because sometimes you're in the wrong office, but if you trust that person will make the best decision for you and your family. They'll say, that is a great question you have. That's not in my wheelhouse, but I can send you somewhere that does. And that trusted provider most likely has a network of trusted providers within their circle that they can refer you to. And if you don't like that person they refer you to, then you find someone else. But then you start building this network of providers that you truly trust, and they can help you build out that network even more. And then you can share those providers with your own family members and the people you love as well.
And as a clinician, we got to get past ourselves. I come up over the years where we're worried about, is the therapist down the street going to steal my patients, or am I going to have enough? Only about 10% of people who would benefit from physical therapy ever make it there. And so we need to get
Isn't that wild?
Yeah.
Only 10% of the public ever go to PT.
And we've got to get over ourselves to say, no, I'm going to be fabulous at what I do so that people trust me. And I'm going to, if the person next door is better at inner ear balance stuff than I am, it would be irresponsible of me to not do the best thing in the best interest of my patient and send them to the guy next door that's better than me than that. Mm-hmm. Because there's going to be something I'm better at also. And if we have that trust across the profession, one clinician to another, and quit worrying about turf battles, but get on with getting patients better, there will be so many patients that will utilize us because we're the best positioned providers for musculoskeletal and neuromuscular injuries.
Yeah. And this is kind of my thoughts to our physical therapy profession. A lot of us, I'm not sure why, but have had this scarcity mindset. Mm-hmm. It's this idea that there's this pie, and there's only so much pie to go around. And if you eat a piece of the pie, there's only so much for me left. But I want to change that mindset so much into this level of abundance that there's so much pie that you can't even eat. There's so many patients to be served. We're literally only capturing around 10%. I opened my first clinic just over 4 years ago. And Mountain Land Physical Therapy, which now you're partners with, opened up literally not even a block away. It was, I think, 3 buildings down. And a lot of people asked me, are you mad about that? And I said, absolutely not. Why would I be mad about that? They literally are my allies. They are my profession. Why would I not want more of them? I actually want one there, and I want one there as well. So Mountain Land, if you can get me another clinic right across the street, or other PT clinics, we need more. We have so much goodness that we can provide for the communities that they don't even know about. You think about Home Depot and Lowe's, what do? They always bunk up right next to each other, and they're practically the same store, right? They are technically competition, but they believe in this abundance mindset that people are going to have a preference. There's going to be a specialty that one clinic has than another. I can't tell you how many patients we've sent over to Mountain Land because it's either not our specialty or we don't take that insurance. And it's this mutual, and they do the same for us. They send us patients as well. And it's created this network of people that truly care about patients and want the best for them. But if there's anything I hope we change here in Utah, in our profession in general, is this idea that there's too many patients to serve.
Primary Children's Hospital from Intermountain is probably one of the premier children's hospitals in the Intermountain West. And their motto is the child first and always. And I love that motto because their goal is to take care of kids. Our goal is to change people's lives for the better using physical therapy. It's not about Howard's clinic or Brad's clinic, in our turf. It's about the patient. It's about the individual. It's about the kid, the mom, the dad, grandpa, grandma, the postpartum mom. It's about them. And if we as an honest clinician are looking out for the best interest of that individual, we're going to send them where they need to be. And then they'll come back because they knew, Dr. Powell took good care of them. Dr. Quackenbush, didn't serve himself. He served me. Mark Anderson gave a talk at the spring conference a while back talking about service-based leadership. The servant leader is what he called it. And you'll be a better leader, you'll be a better clinician, a better individual when you serve others. And as soon as you get to that mindset that I'm going to serve my patient and their needs, all the rest of it will take care of itself.
Yeah, it really does. And I've definitely seen that. I love that service-based mindset. Let's shift gears a little bit here. It's along the same lines, but tell us about this chief delegate role that you've been doing. What is it about? What are some things that have been done, especially here in Utah in this last year, that you've been a part of?
So, great question. We need to back up a little bit and understand what the delegation or what the delegate does. Change for physical therapy's profession happens at two levels. It happens at the state level through your state association, and then it happens at the national level through the American Physical Therapy Association. And what the Utah delegation does is they represent Utah's ideals, interests, ideas to the national APTA as far as bylaws, motions, or objectives for the board of directors, what they should be following for the next year. In Utah, we have 5 seats on the national delegation. And in July, there's meetings throughout the year of trying to decide what changes do we want to make to the profession? What do we want to see happen? And try to move the profession forward. So I was I first ran for delegate and lost by 3 votes. And then the next year, they asked me to run again for delegate, and the next year I lost by 20 votes. And so I was like, well, apparently I'm losing ground on all this.
It's getting worse.
It's getting worse.
How is that, Howard? Everyone loves you. I'm wondering who was voting for the other guy.
and at that time, we had four delegation seats. Well, the third year they came and said, Howard, you've been so close. We want you to run again. I said, I'm not going to be that guy. I'm not going to keep
Gonna lose
running.
by 40 this time.
Just keep going downhill. It hurts my feelings. But they said, no worries. It's a brand new, it's the fifth seat and no one else is running. So you're probably going to get in.
That's how I got my seat.
And the funny thing is I didn't win unanimously. But so I was a delegate. And when you're a regular delegate, you're invited to come to state meetings, but they're not an obligation. But I decided I wanted to be more involved, so I started attending those meetings, and then went to the national meeting and represented Delta with our chief delegate, our state association president, and the other delegates. Had a wonderful experience, and I started working the room. I like people, and and I say, well, I know that person from the sports section, I know that person from the orthopedic section, I know that one from the private practice section. So I started just working my network. Getting to know, hey, I'm here, we're having a great time, here's what Utah's thinking. The following year, our chief delegate was unable to serve anymore, and so I was appointed in that chief delegate position. Apparently, the only way I get to serve is if there's no competition.
There you go. I'm the only guy.
And so we did that, and so then I was elected. So I'm on an elected term this term. But as chief delegate, it's my responsibility to specifically represent Utah's interests to the Western States Caucus, and then to represent Utah's interests in all the voting that goes on in the House of Delegates out in Washington, D.C. And this year was a landmark year for us because partly because of our relationships that we've developed in Utah around with other components, they call it, or other groups. Each state is a component, and each specialty section is a component. And so there was a big push to try to fix what ails physical therapy. And for most physical therapists, our payment, not for most, but for the profession, our payment's been declining for years because of the physician's fee schedule. But the feeling has been that what's APTA been doing, for me payment-wise, what's really been going on. And so there were two specific motions and a bylaw that went in, came up for debate. And in Utah, we aggressively supported one that was proposed by the private practice section to make the main focus of the board of directors is to increase payment for physical therapy.
Can you say that again? Yeah. What is the main purpose of APTA?
The motion was we want the main focus for the APTA National Board of Directors to be payment improvement in physical therapy. And you'd be surprised.
Why is that? Just give us a general sense. I don't mean to derail you here, but just give us a general sense of why that matters.
Each state has things that's important to them. And so when you go to the National House of Delegates, you can give a directive to the board that they need to study this issue the coming year. They need to focus on this other issue, and so the board gets about 15, 20 things from the states saying, board, this year you need to study these issues, you need to come up with a plan to improve this. And so they get so convoluted that improvement happens. Our national board is fabulous. They really work hard. They're a great group, but they have so many mandates, they can't focus. Okay, they get spread out.
Yeah, there's just too many initiatives. There's too many things that they have to juggle. So I love that they said that. The main focus is to improve payment.
You had been stunned how much debate there was over that and how much heartburn a lot of the components had.
In your opinion, why is that the most important thing we could be doing right now?
A rising tide lifts all boats, so to speak. So if we were able to increase payment, which essentially just means we need to get the physician's fee schedule to, number one, have an inflationary adjustment. Just increase the payment just with the annual inflation adjustment, every budget in the federal government has an inflationary adjustment except the physician's fee schedule.
It's so wild to me.
So inflation has been going up, and we've either been getting paid the same or less every year. But students come out and say, "I can't afford my student loans.
Student loans are going up. Inflation's going up.
Yeah. If I could make more, that helps my student loans. I can't recruit people, good kids to come into physical therapy. If we can make more, we can pay more. If we
it was what you're telling me is the payment solves the majority of issues that we're having in our profession.
And that's where private practice section was proposing that. But there was a ton of debate on it. So Mike Horsfeld, the president of the Private Practice Association, he and I were talking at the House of Delegates. Is how we're getting a ton of pushback. We need somebody, to help back us up. And Utah, we stood up. We said, no, we want this too. People would say they wanted to amend the motion to say, well, we want payment to be one of the things the board of directors is going to study.
Yeah.
And we said, no, it needs to be the thing we're going to do. And after some real vigorous and useful, good debate, it passed with a significant positive margin. And in the House of Delegates, if you look at the breakdown, only about a third of the House of Delegates members are in private practice, the vast majority are in education, and then the other chunk are kind of spread out between specialty areas or hospital-based, other things like that. But everybody became very aware that payment will be the most important thing, and so that changed. The second one that then came up was proposed by Hawaii, Doug White, and he said we want APTA to no longer use the terms allied health profession or ancillary provider. He says we are primary care. And the only two components at the House of Delegates at that point that were considered primary care were the federal component, which is military, and Utah. And I jumped up on my feet and I rose and I spoke in positive form of, in Utah we're doing this, and in Utah we've got this done, in Utah. And Mr. Speaker, Bill McGehee, as I finished, thank you, Utah, for your selfless self-promotion. But it got the point across, and that one passed wonderfly too, because
what a crucial thing. Thank you for your work there. That's so vital.
Everybody wants to be primary care now, because here's the political issue. These changes have to happen on a state level. Utah's doing it now. Utah's helping the surrounding states. A lot of other states are calling our executive
Idaho,
director,
Arizona. Yeah.
Katie Manziel is helping so many other states. She is wonderful. And we're helping them go. As soon as we hit critical mass, as soon as we hit 26 states that are primary care, then we make physical therapists' life better by going to Medicare and the federal pay, the national payers, and say, don't make us do this paperwork anymore. We're primary care. We don't need another primary care entity signing our notes, or we're a team member. Mm-hmm. So people ask, what has APTA done for me? Well, in Utah, you're primary care now, and in the next couple of years, you're going to see that come down the pipe of lots of insurance changes, lots of paperwork changes that are going to be for our betterment. On the national level, the ball has started, the snowflake has landed, and the avalanche is starting. And within a few years, we're going to hit critical mass, and then that allows our board to focus on payment by saying, let's get rid of the administrative burden, let's adjust the fee schedule, and it helps our lobbying efforts on Capitol Hill.
If there's one thing that I wish every physical therapist in Utah knew, with this primary care bill, the reason we did it is to increase our ability to get paid. Mm-hmm. We have been primary care since the 80s. When we developed direct access, we've been doing this job already. Nothing changed in our scope of practice. We're literally doing the exact same job. Now we can just get paid better to do it.
And release some of that burden. And the best part is, as soon as we get all the states on board, Montana is in a beautiful position right now. They've been classified as physicians under the workers' compensation umbrella and are working towards being more, exact in their primary care stuff, being able to do things that are in the scope of physical therapy, but more direct primary care. So
one thing I wish the public understood is that we get paid less all the time, right? There's no profession that I know of that gets a decrease in pay every year, right? You talked about the physician's fee schedule. That influences all of healthcare providers, where that's set at. So if we get paid less every year, but inflation goes up, eventually it becomes to the point where it's unsustainable. And these insurance companies, I just received from my insurance broker how much health insurance is going up this year for my employees. So what we're paying for our employees to get health care. So last year, they went up 10%. We got a decrease 3% in pay. How does that make sense? Hold on. Health insurance is to make 10% more in premiums, but the people providing the service get 3% less. Makes no sense. Guess what the increase is this year? 13%. So in 2 years, our premiums for health insurance have gone up 23%, but we get paid 3% less, and we're the ones providing the service for the patients. It makes absolutely no sense, right? So that's why when we're talking about advocacy on a national and a state level is so important, because there is eventually, we cannot stay where we are. We have to advocate. We have to get better, right? Tuition's going up. It's a doctoral degree. Like, we're becoming more specialized. We're a part of this frontline service, providing service to these patients, but we're not getting paid to do it, right? And that's what this whole challenge in this fight is about.
And the wonderful thing about directing the board to focus on payment also helps us align better with the other physician groups, AMA, chiropractic, everybody who provides any sort of health care on the physician's fee schedule. We're now all in the same fight together. And so we can become allies as opposed to associates in it. We're all
fighting for a certain dollar. It's like, no, let's do this together and improve payment for everyone.
Because if we don't, we'll soon become a system where if you have cash resources, you'll get any service you want. And if you don't have cash resources and rely strictly on insurance stuff, because of the payment scales, you'll get either very limited services or you'll be in a longer line to get there. And that's not advocating for our patients.
Yeah. Oh, I love that so much. Okay, as we wrap this up, this has been such a powerful conversation on how to improve the healthcare system as a whole, advice for both parents and for providers, just so many good things that we've covered today. Is there anything else that you wish that our physical therapists in Utah understood about what their association's doing for them? What are you hoping that they would know?
I think historically we've had the perception of I've just paid my dues every year and I really don't see any good coming out of it. I think what the associations and things are doing now is like as a physical therapist. I need to, and my mom that didn't know, forgot that I did this for them. I think the therapists need to know that APTA Utah is focused on moving primary care provider status forward to where we can then work directly with insurance companies. We can decrease copays. We can increase access for patients to get there. And we're actively doing that. We spent more time on Capitol Hill this last fall and winter than I can remember, and we were terribly successful. We were also successful.
Terribly successful.
It was so we expected it to take so much more time, money, and effort. But as soon as we started calling House of Representatives and senators, they all had a therapist, and they were very supportive of this.
100% supportive, right? It passed unanimously in both the House and the Senate.
And it was interesting that we were stunned. But as you look back, it's like it should have been that way. And so everybody, not just in the healthcare world, but everybody wants to fix this insurance and healthcare fiasco that we've developed over, 30, 40, 50 years. We want to fix this, but it's going to take each state doing it. And Utah has been on the forefront, and the surrounding states are getting there. From a national level, there really is a lot of advocacy going on. In July, we took an extra day where every state went to every senator's office and every House of Representatives office on Capitol Hill and visited with them about the Medicare inflation adjustment, about the SAFE Act, helping seniors avoid falls and getting a referral to physical therapy to help seniors decrease their fall risks, about locum tenens, trying to get therapists and doctors to have coverage in their small clinics, because that only applies to very rural areas. It doesn't even apply to Delta anymore. In my little town, you have to be smaller than Delta to have locum tenens access, and on and on. And those were efforts that were put together, arranged, and done by APTA National. There is a lot of work by other groups, APTQI, others that are trying to move the profession forward.
Tell me about 3 or 4 things that we've done in Utah just recently that members might not know about.
We've been advocating on Capitol Hill. We've been pulling groups, private practice groups together who are not necessarily members of APTA Utah to help coordinate the efforts for physical therapy to increase access for patients, also with this primary care motion bills. We're currently lobbying.
We literally, it's Ty and I had delivered, I want to say over 15,000 primary care stickers all across the state of Utah to over, I want to say around 90 clinics. We are spreading the word. It's spreading like wildfire. We're making these challenges, right? We sat before the board of Utah High School Association to expand our scope with providing physicals, right? We're advocating for that, right?
We had this year's review for the Occupational Professional Licensing Review, or OPLR, and one of their comments was, I was in the airport and I saw a placard showing that physical therapy is primary care, and they said, we love that. We're working with them to expand.
I had a PT reach out to me and said, why in the world are we spending our money on airport billboards? That is the dumbest thing ever. Here's the reason why.
The reason why is because my mom forgot I did that. Well, we want the state people who direct our Practice Act and changes to it to say, oh yeah, they are primary care, and we need to continue to allow them. And because of little things like that, they came back with some wonderful recommendations about expanding. Number one, we have imaging in Utah for X-ray and MRI. But not CT, not these. They want to just say imaging, period.
Yeah.
There's things because we've promoted.
And this is all volunteer. I mean, this group of people, this board of directors is all going around and just making change everywhere, right? I remember Oppler called me literally on the phone with them for an hour. They're examining our profession. They only do it every 10 years. And she's presenting to me all of the amazing data that she has. She's like, we are blown away with what physical therapy is doing for the healthcare system. We are looking for ways to expand your scope of practice because there's literally nothing you're doing to harm people. And we want to give you more opportunities to serve people better because of how well this profession has done at serving the community.
And they have that data because the national board has funded studies and things to say, here are the data points, here's the numbers. They give them to the state, and then the state advocacy. And it really depends on how aggressive your state board is willing to work. And they are volunteers. Nobody's getting paid on the board. It's all volunteer. But I guess in my mind, someone asked me the other day, Howard, why are you doing it? And the answer is, I'm at the end of my career. I can probably count on 2 hands the number of years I'm going to keep practicing, if that long. Okay, but I want to leave.
You got at least 20 years, Howard.
I'll be really old then. But we've got to leave it in a better spot than I found it. Yeah. I found it in the physical therapy was just coming off of heat ultrasound massage. That was therapy. Mm-hmm. We were trying to do
ancillary service.
Yeah, we were doing. We were revolutionary by doing Shirley Sarman's musculoskeletal balance stuff, and the back protocols and trying to standardize care and trying to have evidence-based practice was just like out of this world. Now it's so standardized. So it's been improving. I want to leave it just a little bit better. And if I can do it as the chief delegate advocating in Utah and on a national level to say, let's focus our efforts to help all PTs, whether or not you're in the association or not. Okay. Again, I don't care if I'm not competing against my therapist across the road. I want him to be my ally. I would love you to be in the association with me, but if you're not, I'm still going to try to do things that are going to benefit you, because personally, as Howard Quackenbush, an individual, I want to ride off into the sunset going, I somehow left the world a little better place than I found it.
Yeah, I love that, Howard. You're such a strong advocate for that. Let's give our APTA Utah members a 1, 2, 3 items on what APTA does for them. If you were to talk about your top 3 things that the board of directors is consistently doing to benefit them in their profession, what would you say?
I think protecting the profession is number one. We're constantly watching out on the legislative and state and national level about encroachment on our profession. We want to protect the term physical therapy. We want to protect our ability to provide care. So number one, they're always monitoring bills on Capitol Hill that are changing, that would influence us if we're not having input. Number two, we are working really quite hard with individual insurance companies. We visit several times a year with Select Health, with Blue Cross Blue Shield plans,
workers' comp,
to educate them on physical therapy saves the patient money. If you can choose a physical therapist first, you are going to save the entire system money. And if we save the entire system money, it ought to trickle down to everybody having cost savings. And then probably the other one that I think is a little less understood is we're trying to improve the profession for better through continuing education, through opportunities for physical therapists to interact, to have opportunities to be around each other. The fall meetings are wonderful. The spring meetings are great. And people a lot of times try to use those, well, I need my continuing education units. It's not about that. It's really about, again, we've talked about relationships. It's building relationships, building a network, getting to know who's my therapist next door. Are they a real person? Can I, trust them? Who's going to be my network? And really, if the association is about allowing us to get together to be better as a group and bring what I do well to the group so that the entire group does well, and then taking from the group things that'll make me a better person when I leave.
Yeah. And I love this. Someone told me this last year. They said, we cannot go into 2025 without doing this together. We've done this, the physical therapy profession, individually for many, many years, decades. But we cannot move into 2025 and 2026 without a team. And that is both physical therapy, that's healthcare in general. We have to link our arms together as one. And that includes the patient as well. We have to do this collectively together if we want the healthcare system to improve. So thank you for joining us today, Howard. We appreciate what you're doing. Thank you so much for spending the most wise years at benefiting our profession in healthcare. You're bringing so much wisdom into this, so much background, and it's so beneficial. And I'm just such a huge fan of the work that you're doing, and of you as an individual. You've been such a mentor to me as I've watched you and learned from you, and just appreciate so much of who you are and what you do.
Yeah, you're too kind, and thank you for having me today.